Reproductive Health Part 2. In this video, you will be learning more about contraception and contraceptives. What are the features of an ideal contraceptive? So, an ideal contraceptives are the devices that prevent unwanted pregnancies. Now, if we look at the features of an ideal contraceptives, it has to be user friendly. That means it has to be used very easily. It can be used by the user without need of any medical help, and it should be easily available and cost effective. It has to be effective. So when one uses, it should prevent pregnancy. It has to be reversible, meaning that it is only preventing pregnancy for a short period of time. And so when you're not using it, it should help in an individual to become pregnant, has little or no side effects, and it should not interfere with sexual drive or the desire. Methods of contraception. Natural methods, barrier methods, and surgical methods are the three methods of contraception. Now let us look in detail about each of these methods. Natural methods. One is periodic abstinence. Couple avoid or abstain from coitus from days 10 to 17 of the menstrual cycle when ovulation is expected, as the period is very fertile for conception. Withdrawal, or it is also called coitus interruptus. The male partner withdraws his penis from the vagina just before the ejaculation to avoid insemination. Lactational amenorrhea. During lactational period after parturition, there would be a period where no ovulation occurs and hence no menstruation. Such a period we call it as lactational amenorrhea period, and it is considered to be safe, but it need not be safe in some of the cases. Method. In this method of contraception, sperms and ovum are prevented from physically meeting with the help of barriers, and such methods are available to both males and females. So let us look at them. One is the condom. They are the barriers made up of thin rubber or latex sheet that are used to cover the penis in the male or vagina and cervix in the female just before the coitus, so that ejaculated semen never enters into the female reproductive tract. Both male and female condoms can be self-inserted, disposable, thus giving privacy to the user. Diaphragms, cervical caps and vaults. They are the barriers made up of rubber and are inserted into the female reproductive tract to cover the cervix during coitus. They prevent conception by blocking the entry of the sperms through the cervix and are reusable. Spermicidal creams, jellies and foams are used along with these barriers to increase their contraceptive efficiency. Use of intrauterine devices. These devices are inserted by the doctors or expert nurses in the uterus through vagina. And these IUDs are presently available as non-medicated IUDs like Lipislu, copper-releasing IUD like copper T, multi-load 375 and so on, hormone-releasing IUD like progesterone LNG20. IUDs enhance phagocytosis of the sperms within the uterus, and copper ions release suppress sperm motility and fertilizing capacity of these sperms. Hormone releasing IUDs make uterus unsuitable for implantation and cervix hostile to the sperms. Use of contraceptive pills. Oral administration of small doses of either progesterone or progesterone estrogen combination is another method of contraception. They are used in the form of tablets and they are called the pills. Pills inhibit ovulation and implantation as well, and so it alters the quality of the cervical mucus to prevent or retard the entry of the sperms. Pills have lesser side effects and are preferred by females. Last one is the surgical methods. These are also referred to as sterilization and can be done both in males and female partners. Surgical intervention blocks the gamete transport and thereby prevent conception. Sterilization procedures in male is called vasectomy and in females it is called tubectomy. In vasectomy, a small part of the vas deferens is tied up through a small incision on the scrotum. In tubectomy, a small part of the fallopian tube is removed or tied up through a small incision in the abdomen or through vagina. These techniques are highly effective but have poor reversibility. So once when one undergoes a surgical method, conception cannot take place and it is not reversible. And so they, even if they want to, some of the times they go in for reversal, but it is not very successful.